Hi, good evening, everyone, and happy holidays. This is Maria Sophocles, and today we're going to do Ho Ho Hot Flashes, talking about this holiday season, which between COVID and the usual holiday crunch of too much to do in a busy society, what can we do and how can we minimize stress in our lives, which will minimize hot flashes for all of us? Um, as you know, I'm a gynecologist and a menopause specialist, and I am the founding physician at Women's Healthcare of Princeton in Princeton, New Jersey. And if you're watching, you probably already know that. And if not, welcome to our family where we have YouTube live broadcasts and Facebook live shows to help educate women on basic health topics and sometimes complex health topics. So tonight we're going to talk about hot flashes, and not really just hot flashes, but hot flashes as sort of a metaphor for a lot of the menopausal changes that happen before menopause actually happens. That's called the perimenopausal transition, um, and um, and after as well. Just to recap, menopause, the definition of menopause is no periods for 12 months. And once you've had no periods for 12 months, we say you're menopausal or postmenopausal. But the months to years, even to decade or so before that happens, is a very hormonally chaotic period when estrogen and progesterone are fluctuating. And we call this the perimenopause, Perimenopause, perimenopause. Peri means around. So it's the time around menopause. And perimenopause can be mind numbingly frustrating because you're still having periods. So you're not thinking of yourself as menopausal. And yet you're moody, you're quick to tears, you're snapping at people, you're saying things that you can't believe have just come out of your mouth. Um, your periods can be heavy, light, frequent, infrequent, unpredictable. Your mood's unpredictable. You can experience joint pains and hair loss and um, hot flashes and night sweats and anxiety and all kinds of things you honestly never thought were going to be part of your 40s. So that's all frustrating enough. But then to have to deal with that in the month of December, which when you're 8 years old is just your favorite month of the year because you're counting down until Christmas and tearing open packages at top speed. But at 48, you may be thinking, how am I going to get presents for everyone I know, lose the 10 pounds I said I would lose this year before the new year, get my Christmas card printed, buy things for my Christmas office party, and still do that presentation that my boss is expecting by Tuesday. So it becomes sadly, a very stressful time. And what we know, what's incontrovertible, is that menopausal symptoms, including hot flashes, night sweats, and mood changes, are absolutely affected by stress and by sleep. And the reason I bring both of those up is that often when we're stressed, we don't sleep as well as we otherwise would. So um, I'm here to tell you that one of the best things you can do to reduce hot flashes and menopausal symptoms this holiday season is to think about your sleep. Think about how you sleep. Think about if there's any ways to improve your sleep. And then we'll talk about mental health in just a minute. But sleep is something that I want everyone listening to be aiming for 7 to 7.5 hours or more. That may seem like a complete joke because some of you are sleeping 2 or 3 hours and then getting up and then having trouble falling asleep and then sleeping and then getting up, et cetera, et cetera. If you're awake, if you have no trouble falling asleep, but you have trouble staying asleep, this is very classic perimenopausal sleep disruption. A couple things that may help, and they all fall under the big term sleep hygiene. So, sleep hygiene just means a couple things. Number one, set a sleep routine. Go to sleep at the same time every night. And, oops, what is that? And try to sleep same time every night. Try to wake up the same time. If you're up super late on a Friday or Saturday night, don't try to sleep till noon to catch up. Try to wake up when you normally wake up, even though you'll be tired. Number two, limit screen use, phones, computers, TV, Netflix binging in the evening. This winds your brain up and makes it harder for it to wind down and go to sleep. Number three, of course, limit caffeine, especially afternoon and on. Caffeine, if you need it and have to use it, should be a morning thing only. Number four, exercise. Exercise is wonderful and it does help us sleep better, but do not exercise at night or right before bed. So exercise, but exercise early. Number five is if you're stressed or if you have a lot on your mind, go ahead and write it down, write it out, even if it's right before you sleep. We know that if you write stuff out, get it out of your brain, even literally, you're less likely to have it be nagging and gnawing in the back of your brain, and it'll help you with sleep. These sound really common sense, but they sometimes buy us a lot of help. Is it okay to take medications for sleep? Absolutely. There's a lot of shame associated and stigma that if you take meds for sleep, you're somehow going to be addicted or you're a drug addict or there's something wrong with you. Sleep disorders are incredibly common in women and incredibly common in peri and postmenopausal women. Sleep is also linked, or lack thereof, is also linked to heart disease and increase in early onset of heart disease, and longevity is linked to good sleep. So we want you to sleep, even if you need some medication, short term or once in a while. And I urge you to take away your own shame or stigma, and think about what it would feel like to get a really good night's sleep, even just once or twice a week. And believe me, sleeping well once or twice a week is um, radically different than night after night after night of poor sleep. So, for many of my patients, we'll try melatonin. We'll try something like over the counter Benadryl. Um, we'll even try warm milk at night. If none of those are helpful, there is a new class of sleep medications, and they are specifically designed not to be habit forming. So you can ask your clinician or send us a message at princetongyn.com, our website, princetongyn.com. Go to the patient portal and message us. We would be happy to teach you about these medications. They are not habit forming and they are safe. So that's how sleep relates. Sleep relates, as I said, because the better your sleep, the more able you are to handle stress. And stress itself, whether linked to poor sleep or not, is definitely related to hot flashes and getting hot flashes. So, what other ways besides handling stress and having good sleep can you help yourself reduce the hot flashes of menopause and other menopausal symptoms? Well, there even in COVID times, there are going to be parties and dinners and opportunities for alcohol, and we know that alcohol does increase, sort of as a trigger to hot flashes and night sweats. So limiting alcohol will reduce hot flashes and night sweats. Okay. Um, Caffeine also, as much as you want to have that caffeine, need that caffeine in the morning to wake up, know that caffeine use is directly linked to hot flashes and night sweats. And then what about treating them? What about, okay, Dr. Sophocles, I've done all of these things. I already do these things, and I still get a lot of hot flashes, night sweats. What can I do to treat them? Well, if you were coming into my office today, I would teach you about the three baskets. The three baskets are my way of saying there are sort of three big um, therapeutic ways to help with hot flashes. The first basket is complementary and alternative medications and treatments. This includes acupuncture. This includes aromatherapy massage. This includes dietary supplements like black cohosh or maca. So these things have been shown to help hot flashes and menopausal symptoms, but they've been shown to do so in an inconsistent way. So while I can't tell you, um, take a supplement of black cohosh, everything will be fine, I can tell you black cohosh formulations, such as Estravan, for example, which are available over the counter or at a pharmacy, are helpful sometimes to some women. So you can certainly bark up that tree of complementary. And that's sort of basket one. Okay, you can try going to sleep with a lavender pillow. You can try purchasing clothing that wicks away moisture and bedding that wicks away moisture. These are all available online. You can try mindfulness, meditation, um, cooling packs, wearing thin layers, multiple thin layers instead of heavy clothing, wearing having bedding that is very light as opposed to a duvet or something heavy. All of these things can help. Um, the second basket is really prescription medication that's non-hormonal. There are prescription medications that are not hormonal that have been shown to help hot flashes and night sweats. Among these are gabapentin, Gabapentin. Gabapentin. Gabapentin is a pain medication, but it is also used to reduce hot flashes and night sweats. It has a side effect of sleepiness, but you're going to have to weigh the risks of side effects versus the benefits of reducing your menopausal symptoms. And so we use gabapentin off label for hot flashes and night sweats. Another medication that we use that is not hormonal is oxybutynin, Oxybutynin. Oxybutynin, Oxybutynin, is actually YNIN, like Nancy, Isaac, Nancy, this is a bladder medication that we actually use for overactive bladder, but also as a side effect, it reduces hot flashes and night sweats. Thanks, Sam, for correcting that. And it'll reduce them by maybe 30%, like the gabapentin. So not perfect, but certainly better than nothing. Other medications that reduce hot flashes and night sweats are antidepressants and anti-anxiety meds. We call these SSRIs or SNRIs. And that's the class, SSRI/SNRI. These are traditionally developed for depression or anxiety, but again, as an off-label use, they reduce hot flashes by 30 to 40%. So again, not perfect, but if they just take away some of the hot flashes and night sweats, and that's all you need for help, then you're in good shape. So the third and final basket has to do with using hormones to reduce these symptoms. This is called MHRT, menopausal hormone replacement therapy. MHRT is the gold standard. It works the most rapidly, and it works the most robustly, and it works the most consistently. And this is because it's fixing the problem. The problem is that as we're in perimenopause, our ovarian function fluctuates. It doesn't just shut off, it fluctuates. And those fluctuations make really chaotic hormonal milieu in our body. And so giving MHRT provides stability. It's a slow, even dose of the same thing. And so it takes that fluctuation and just smooths it out. And it works fantastically well, very predictably. I can count on one hand the number of women in 28 years who haven't been helped by this. I probably have fingers left over. We give MHRT to fix hot flashes, night sweats. We also give it to reduce our risk of osteoporosis, um, and to reduce the risk of cardiovascular disease, coronary artery disease, and even to help with vaginal dryness. The benefits are numerous. They're well studied. But since this episode's about hot flashes and the stress of all these menopausal symptoms, I want to focus on the fact that we use HRT as a treatment for hot flashes and night sweats. So how do we use it? How do we give it? Well, there is one formulation that is one pill that has the estrogen and progesterone mushed together, and you take that one pill every night with food. That's super easy. But other than that one formulation, the other formulations involve progesterone as a pill that you take at bedtime. Why? Because it helps with restfulness, calmness, and sleep. So, great time of day would be to take it at bedtime. And the progesterone is combined with estrogen that we take transdermally. Why? Because it's been shown that if the estrogen is transdermal through the skin, it is safer for us. Okay. It bypasses something called the first pass effect of the liver, and you have less elevation of cholesterol and triglycerides. So that's safer. So now we use estrogen as a patch or as a gel. So the estrogen we use is bioidentical. And I think it's really important for you all to understand what bioidentical means. Often patients come into my office and they say, oh, I want the really natural thing, bioidentical hormones, the thing you have to get at a special pharmacy, or the thing that someone makes from plants. I want that, bioidentical hormones. That's not bioidentical hormones. Bioidentical just means it's biologically identical to what's in your body. So almost everything that's made for MHRT is bioidentical, all made by drug companies in factories. Nobody's out collecting yams in a field. They're synthetically made by pharmaceutical companies, and they are bioidentical. So bioidentical estrogen is called estradiol, estradiol, estradiol. Estradiol is bioidentical estrogen. It's also the type of estrogen, because there are 3 types in the body. It's the type of estrogen that's the most prominent and prevalent in our body. So estradiol is what we want to replace. And luckily, that is exactly what you're replacing when you use a patch, or you rub a gel, or you take a pill of estrogen. Okay. So the patch is 2 times a week. The gel is every day. And I don't really care what you use, whichever works for you, whichever you like, whichever you can remember. I myself use the patch because it's easy. I put a little tiny patch that big on my tummy 2 times a week, and I'm set. And it gives me a tiny amount of bioidentical estrogen, estradiol, to help my bones, to help my arteries, to help reduce cardiovascular disease. It's probably helping my skin, my hair, and a whole bunch of other things. But it's preventing hot flashes and night sweats, and that's fantastic. So I think that's really important. I think the thinking of ways to help these symptoms in terms of options, kind of behavioral options, right? Reducing stress, limiting caffeine, limiting alcohol, aromatherapy, massage. Interestingly, that's actually been studied and shown to reduce hot flashes. Optimizing your sleep, maintaining your weight. That's something we didn't talk about. That's a tough subject because people are like, I've gained weight during COVID. Don't talk to me about weight. Well, I kind of have to. I kind of have to bring it up because we know that with weight increase, you increase the hot flash severity and the number of hot flashes. So maintaining or even reducing your weight will help the frequency and the severity of hot flashes. So if you're thinking of a reason to lose weight other than fitting into um, your Christmas party dress, reducing the hot flashes that are bothering you is a great one. Not so easy to do, I know, but our practice does a lot with weight management. And in January, we're going to be launching something called Way to Go, WEIGH, Way to Go, which is sort of our um, practice within the practice of helping with weight management. And if any of you, really wish you'd have an accountability buddy or just a partner in crime to help you kick off 2022 with good guidance towards maintaining or losing weight, by all means, call us or come in and see us. So again, let's recap. Behavioral ways this holiday season to manage hot flashes are to maintain your weight, to limit alcohol, to limit caffeine, to optimize your sleep, to minimize your stress. And if none of that's working, to consider medications for sleep and or medications for hormone replacement therapy or non-hormonal prescription medications. There are a lot of options and you don't have to suffer. You don't. And if you're too busy to come in, then call the office and ask for a telemedicine visit. We do telemedicine visits. There are now 6 female clinicians at Women's Healthcare of Princeton. It's so great. Thank goodness. I have so much help now. I'm so happy. So we can certainly accommodate you. You can call the website or you can call our phone number. I'll pop them up on the banner, but there are lots of options to help you and you do not have to struggle or suffer. I feel bad. I've just been talking away. If anybody out there has any questions, please ask them. This is an open forum and we're happy to do Q&A. You can go to princetongyn.com to send me a note in the patient portal, or if you have any questions during this live stream, sometimes patients will pop in and just ask their question. So that's about it. I wanted to keep tonight short and sweet because we all have lots to do. I've got to go work on my holiday cards myself. But I want to tell you all, I'm so grateful for you. I love taking care of you all. And I love being able to share a little bit of evidence-based information about menopause for women and their significant others so that we can all understand that this is not a disease, this is a chapter in life, and it's as good a time as any to celebrate health, to take control of our health, including our behavioral health, and to be grateful, for what we have. So this is Dr. Maria Sophocles from Women's Healthcare of Princeton, wishing you all a happy, safe holiday season. Please, if you're not vaccinated, please consider getting vaccinated. If you're vaccinated but do not have your booster, please consider getting your booster. We're seeing a lot of cases of COVID in our vaccinated patients who have not been boosted yet. So if you have any questions or you want to know more about that, you certainly can go on the CDC's website, or you can again send us a note in the patient portal. We'd be happy to help you understand whether or not you're due yet for a booster. But I've had many patients who are vaccinated get COVID in the last few weeks. So I really, truly hope you all will take care of yourselves and your families and be the advocates, educate yourselves, get educated, and understand that we need vaccination as a community, as a society, and as a country. And so often in countries, it's women who are the ones who are the sort of family educators about healthcare decisions. So hopefully you women watching can really advocate for your families and help them understand how important it is to get vaccinated. So here's a patient who has a question. I've done all you said with the exception of medication, but my doctor said I have to not have a cycle before 12 months before she will say that I'm going through menopause. Sure, that is the technical definition of menopause, but there's no reason you can't have medication for your symptoms. You don't have to wait, Angela, for those 12 months to pass before you get to have some help. So we often, in women who are still menstruating and haven't hit that 12 months of no period yet, especially if you're even still menstruating erratically, we will often put you on the lowest dose birth control pill made as a temporary hormone replacement therapy. And it's really helpful. So hopefully your doctor will be willing to do that. So sure, she can be a stickler about the verbiage before you are technically called menopausal, but you have a right to advocate for getting the help you need for symptoms. I saw 3 patients today who are about 50 to 53, still having some periods, 1 or 2 a year, and their doctors would not help them because they weren't technically menopausal. That doesn't make any sense to me. When you need help, you need help. And your doctor, I hope, is okay giving you the help you need. So go back and advocate for yourself or set up a telemedicine visit with our practice. We would be happy to help you. You do not have to suffer and you do not have to go without medication if it'll help you. Okay. So you're on the lowest dose of the pill, I guess, of the pill. And so that's hopefully helping. If it's not, then we can try you on some non-hormonal options and see if those help. And if those don't help, you can try the lowest dose of HRT. And if you're on the lowest dose of HRT, we can just bump you up ever so slightly. The doses are all so tiny, Angela, that even the incremental increases really should not, they're not risky or dangerous, and you shouldn't suffer side effects from those doses. I mean, they're very well tolerated. Sometimes women will have a little breast tenderness. Sometimes you might have a little spotting that you didn't expect to have, and it's not a perfect world, so sometimes you do have to sort through some of that. But Angela, there should be a way to help you. I mean, this is what we do in my practice all day long. So please feel free to call us. Sure, we accept Aetna, of course, we accept everything. But the lowest dose of the pill, if that's not enough to help those symptoms, oh my gosh, there's so many other options. And we'll just keep fighting and working with you till we find the one that gives you help. I mean, we may not get perfect. We may just get, partial credit, but even that, Angela, I think would be great, because usually that pill will do something. Will do something. But maybe in your case, it's just not doing enough. Just not doing enough. So be happy to help you. Oh gosh, what's the phone number? 609-430-1900. And again, this is Dr. Maria Sophocles. Angela, thank you so much for asking a question, because it kind of often will give other people the courage to ask a question. And then people say, oh, yeah, I kind of had that same question too. Or after we end, many people will watch this later tonight or tomorrow, and then they see, oh, Angela asked a question. Okay, I'm going to go ask something. Okay, good. Well, Quincy says, thanks. I'm looking forward to my appointment. I'm looking forward to you getting this fixed. It's brutal, LOL. I guess we could have also called this episode It's Brutal, LOL, Quincy, because you're exactly right. I mean, sometimes these are really mild and sometimes these are brutal. I had a woman today who said she gets hot flashes in waves 10 or 20 times a day. How can you hold a job down? How can you be with your children or your friends and be getting 10 or 20 hot flashes in a day? I mean, I used to have 2 a week and I was hating it. So please don't suffer, and please don't think this is just in your head. And please don't let anybody, male or female, tell you just to deal with it, because you really don't have to. You just don't have to. And like Quincy said, it can be brutal. And for some reason, this time of year, it's just extra hard. We're wearing hot sweaters, so we get hot. Then we go outside and it's cold. Then we come inside in our sweaters and we're hot again. Then someone builds a fire and we get a hot flash. Then we're stressed out and we get a fan on our desk like Angela does. And the fan is helpful somewhat, but it's sort of never enough. By the way, Angela, fan in your bedroom too, maybe. Fans are your friend right now. Um, and 15 a day, not acceptable. And any more than once a night, Quincy, not acceptable. So let's get rocking and get this fixed. Sometimes, by the way, we help the nighttime sweats just by helping the sleep, and that helps. And there's even a sleep medication that, as a side effect, reduces night sweats. Go figure. Not that anybody intended it; it just happened to be that was a side effect. So there. Oh God, sorry, you're going to give me one vicariously, Quincy. But I really, really hope you all will advocate for yourselves this holiday season. Don't forget to give yourselves a present. Okay, give yourselves a present, and take care of yourself. And it makes you a better mother, wife, sister, aunt, daughter, friend, and colleague. Anyway, I'm sure my staff are watching this are like, yeah, why don't you get your estrogen patch up? Anyway, just kidding. Anyway, guys, Merry Christmas, Happy Hanukkah, Happy Kwanzaa, and everybody have a great holiday season. I'll see you guys in 2022, and we're going to have a great, great lineup of lots more to learn from. Please, if you think of it, send me your requests. What do you want to hear? What do you want to learn? Do you want me to talk less? Probably. We'll get some good guests on and we'll have good dialogue. And I really want you guys involved this year. I want you to ask your questions. All right. Take care. Have a great rest of December. Bye bye.